June is Men's Health Month, and it's a good reminder for men to make sure they're getting the necessary checkups and screenings. So joining us now is Dr. Scott Joy with Inglewood Primary Care at Swedish Medical Center. And Dr. Joy, more men die of heart disease than any other cause of death. So what can men do to take charge of their heart health?
That's a great question. I think when you look at what risk factors are for heart disease, definitely blood pressure is a biggest concern for us in a primary care setting. So we want to make sure patients are coming in at a minimum of one time a year for a blood pressure check. We also know that smoking is a huge risk for heart disease. So we want to get patients in and men in to talk about options to quit smoking. The other thing that we measure in primary care are cholesterol levels. And I think there's been a change over the last couple of years with people thinking the cholesterol number is everything. And we actually in primary care now do a calculator where we put in not only the cholesterol numbers, but the patient's age, their history of hypertension, their history of diabetes, and we come up with a 10-year risk percentage. And sometimes if that risk percentage is in a borderline zone, we'll do a coronary calcium score. It's a special type of x-ray that if patients have moderately elevated cholesterol, we'll do an x-ray to see if they have calcium deposits and then understand if they do need a medicine to lower their risk of heart disease.
Wow, yeah, very important, and some proactive steps there as well. Tell us too, we know cancer is the second leading cause of death among American men. What kinds of screening should men be doing or getting to help catch that disease early?
I think the biggest opportunity for cancer screening in his men is to reduce number of colon cancers. And we now have some new options for colon cancer screening. We used to have only a colonoscopy, and a lot of patients were frustrated with taking a prep to clean out their colon before the procedure. But we now have some stool kits that we can actually mail to patients. They can return at their convenience, and it has really good sensitivity, picking up about 92% of cancers. And if that test is positive, then we do a colonoscopy. But for patients that are at average risk or low risk for colon cancer screening, it's an excellent first test.
Yeah, it takes a little bit of the uncomfortableness away from it, right? Great.
Totally.
Compared to women, men have a higher risk of getting type 2 diabetes at a lower rate. What are the best ways to prevent diabetes?
Preventing diabetes, it comes down to exercise and diet and weight. There is a genetic component where some patients are more at risk based on their family history, but there are some modifiable things that we can do. And a lot of people think you need to lose a significant amount of weight. If you're looking at people who have pre-diabetes, when we see people for their annual visit and they have a glucose level that's in pre-diabetes range, we will check an A1C level. And if that number is between a certain range, then we'll have them work on exercise and weight loss. And really just a 5 to 10% weight loss over 3 years can prevent diabetes by 2/3. So a lot of people think they need to lose 20, 30 pounds. With the data that we've seen preventing diabetes, even a 5 to 10 pound weight loss in a given year can greatly reduce your risk of developing diabetes.
Wow, that's fascinating. I didn't know that. Tell us too, I think we've all kind of seen this. Men are notorious for kind of putting their health on the back burner. What would you say to someone who hasn't been to the doctor in a while, or what would you say to convince them to go?
Yeah, no, I think, I'm a primary care physician. I have a lot of men in my practice, and I just think it's an opportunity to come in for a preventative visit. I think a lot of men wait until they have significant symptoms, and being a primary care doc, we want to pick things up at an early stage. And I tell my patients that there's a lot of things you cannot prevent, but there are a lot of things that you can. And you want to fully take advantage of that. And that's the age-appropriate cancer screening, that's looking at heart disease risk, that's getting the appropriate vaccinations, that's screening for depression. And that's something that we're really emphasizing here. It was a big problem before, and it's even become a little more accelerated here after the pandemic. So get in with your doc. Definitely if you're 50 and above, get in once a year. Earlier, probably every 2 to 3 years, unless you have a chronic medical condition.
Wonderful. Well, thank you, Dr. Joy, for joining us and all this important information. Hope it helps a lot of people out. We appreciate it.
Great, thank you.
Of course. And for more tips on taking care of your health, you can head over to cbsdenver.com.